Have you ever noticed how much weight a single sentence carries in a doctor's office? You walk into that little exam room, the lights are bright, the clock ticks, and you feel the quiet pressure of time. The paper gown rustles when you shift in your seat. The doctor sits across from you, typing on a computer, waiting for your words. And sometimes those words come out softer or shorter than you intended. It's nothing, really, just age catching up with me. That one sentence, spoken almost out of habit, can decide whether you get a real answer or whether your concern is brushed aside. After 60, the way we communicate matters as much as the tests, the scans, or the lab results. Yet many older adults, without even realizing it, make small but costly mistakes in how they speak at the doctor's office. Today, I want to share 5 of the most common communication pitfalls I've seen, why we fall into them, and how to turn them around. These lessons aren't about blame. They're about dignity, clarity, and protecting the life you've worked so hard to build. Before we dive in, if you find comfort in honest conversations like this, hit subscribe. We share stories that don't just pass time, they help make sense of it. Downplaying or minimizing symptoms. This is probably the most common habit. You've been feeling tired, or your knees ache, or your chest feels tight. But when the doctor asks, you wave it off. It's nothing, just getting older. Helen, 78, almost did that. For weeks, she felt heaviness in her chest. But at her routine checkup, she nearly skipped over it. Finally, she said casually, "It's probably nothing." Her doctor, sensing hesitation, asked more questions. That led to tests revealing a heart condition that required urgent care. Later, Helen admitted, "If I hadn't spoken up, I might not be here for my grandchildren." Another man I read about brushed off shoulder pain as stiffness. Months later, doctors discovered it was heart disease showing up in an unusual way. Downplaying symptoms doesn't make you polite, it robs your doctor of the very clues they need. Instead of saying, "It's not a big deal," try, "I've had this pain for 3 weeks and it wakes me up at night." That's not complaining, that's being specific. And it can make the difference between catching something early or missing the chance entirely. Talking in vague or unclear terms. Even when we do speak up, it's easy to slip into vagueness. I've been feeling off. I get dizzy sometimes, but vague language leaves too much room for interpretation. Margaret, 76, went to discuss her blood pressure medication. She had also been struggling with dizziness and poor sleep. But when asked how she was, she replied, "I'm managing." The appointment ended quickly. Weeks later, she fainted at home. It turned out the dizziness was tied to her medication, something that could have been addressed much earlier. Doctors aren't mind readers. They rely on specifics. When did it start? How often does it happen? What makes it worse or better? Instead of, "I get dizzy sometimes," say, "I've felt dizzy 4 times this week. Each episode lasted about 30 seconds, and it happens when I stand up." Suddenly, the doctor has something to work with. Specific words are powerful medicine. Not bringing a written list of concerns. Here's another mistake: walking in without a list. Appointments are short, 10, maybe 15 minutes. You think you'll remember everything, but once you're in that chair, details slip away. A man I knew went to talk about cholesterol. He also had recurring headaches, but once the conversation turned toward diet and exercise, he forgot to mention them. He left reassured about his heart, but the headaches continued. Weeks later, he ended up in the ER with a blood pressure spike. One note on a slip of paper could have saved him the ordeal. Think of it this way: walking into an appointment without a list is like going grocery shopping without one. You'll come home missing something important. And in healthcare, that something could be the very symptom that reveals what's really going on. Before every visit, write down your top 3 concerns. Hand the list over or read it out loud at the start. Even if time runs out, your doctor knows what's still on your mind. A written list is not weakness, it's strength. It shows you value your time and your health. Assuming the doctor remembers everything, we trust our doctors. Some of us have seen the same one for years. It's easy to assume they know me, they remember. But doctors juggle dozens of patients every day. They may recall the big events, your surgery years ago, your diabetes diagnosis, but not the small but crucial changes. Walter, 72, thought his doctor knew about the new blood pressure medication he'd started. He didn't mention it, assuming it was already in the chart. The doctor didn't make the connection, and Walter went through weeks of unnecessary tests before someone asked, "Any new medications?" That question solved the mystery. The new pill was the cause of his symptoms. Your medical record helps, but it's not a perfect safety net. Doctors don't always have time to flip through years of notes before your 15-minute slot. A simple update like, "Since my last visit, I started a new pill and I've noticed swelling in my legs," can save you weeks of confusion. Talking too much without letting the doctor guide. The opposite of silence is oversharing. Many older adults, afraid of leaving something out, flood the appointment with every detail, every tangent, every story. The heart is in the right place, but the focus is lost. Mary went in for knee pain, but in her eagerness to explain, she spent most of her appointment talking about her cousin's hip surgery, her garden, and last month's weather. By the time she described her knee, the clock was nearly up. She left with a vague prescription and no plan. The lesson isn't to say less, it's to say it with focus. Start with your main concern. "I'm here about knee pain. It's sharp when I stand." Then pause. Let the doctor ask questions. This isn't giving up control, it's building a partnership. The right detail at the right time carries more weight than a dozen scattered ones. The doctor's office is more than a place for tests or prescriptions. It's a crucible where your words shape your care. If you minimize, speak vaguely, assume too much, or overwhelm with details, you risk leaving without answers. But with clarity, specific descriptions, a written list, quick updates, and a willingness to let your doctor guide, you can transform a rushed 15-minute slot into a meaningful conversation. You move from being a passive patient to an active partner, and that shift can change the outcome of your care. I know these changes aren't easy. Many of us were raised to tough things out, to be polite, to not waste anyone's time. We've spent decades putting others first, our children, our work, our communities. But when it comes to your health, minimizing or deflecting isn't a kindness, it's a risk. Clear communication is not complaining, it's courage, it's self-respect. It's an act of love for your future self, the one who still wants to walk the beach, to laugh with family, to garden in the morning sun without pain. Every detail you share, how long the pain lasts, how often it comes, what changed since last time, becomes a building block for your doctor to use. Your words are as important as the stethoscope or the scan, and unlike prescriptions, they cost nothing but honesty. Think about that. Your words are medicine too, so next time you walk into that exam room, take a breath. Bring your list, speak clearly, share what's new, and then trust your doctor enough to guide the conversation forward. Now, I'd love to hear from you. Have you ever walked out of a doctor's appointment feeling dismissed or relieved because you finally spoke up? What words, phrases, or approaches have helped you be heard? Share your story in the comments. Your experience may be exactly what someone else needs before their next appointment. Thank you for spending this time with me. Stay strong, trust your words, and I'll see you in the next video.